Hello, I'm Wendy Holden and I'm a consultant rheumatologist and I'm medical advisor to Arthritis Action. I'm going to speak about some of the professionals and specialist services that you may come across if you are living with arthritis, plus tell you about what these professionals do so that you can ask for specialist help if you need it. Once you've been diagnosed with arthritis, you might be happy managing your symptoms on your own or alongside your primary care team, including your GP, or you may need some extra support from other healthcare professionals who are often based in a community or larger hospital. Firstly, the rheumatology team. This usually includes a consultant rheumatologist who leads the team and is a medical doctor who specialises in joint problems. They usually arrange tests, make the diagnosis and suggest treatments, including medicines and joint injections. Consultants are usually helped by rheumatology clinical nurse specialists who can also assess joint problems and who usually have more time to discuss self-management and lifestyle issues that are critical to living well with arthritis. The rheumatology team usually has one or more junior doctors who may be training to become a rheumatology consultant. These are called specialist registrars. Rheumatology teams also often include specialist therapists, including occupational therapists, physiotherapists, and podiatrists. Physiotherapists are experts in physical therapies to help with managing pain and improve function. They can often give advice on specific exercises and stretching to help with joint and muscle pain, and advice on exercise in general. And they often have access to a hydrotherapy pool to help with exercises in the water. Many physiotherapists have additional training in managing sports injuries, acupuncture, massage, or Pilates. NHS physiotherapy departments are unfortunately usually extremely busy, and therefore physiotherapy sessions can't continue forever. Your physiotherapist, however, will show you exercises to help prevent joint problems in the future. It's important to try and continue these yourself at home whenever you can. Occupational therapists are experts in helping people adapt to their problems, and they can help with practical solutions for problems to do with everyday life, such as dressing, washing, and mobility. Occupational therapists can advise on gadgets which can make life easier for you in the home, for example, pulls for zips, and kitchen devices. Occupational therapists can also often help with lifestyle advice, such as relaxation exercises and exercise in general, and they can also help make hand splints to help improve hand pain and function. Hand therapists are usually specialised occupational therapists or physiotherapists who have had extra training in problems to do with pain and reduced function in the hands. They can advise on suitable splints, which are joint supports, and they could give advice if you are thinking of having hand surgery, both before and after the operation. Podiatrists, who are also sometimes known as chiropodists, are experts in problems to do with the feet. They can advise and make suitable insoles for your shoes, for example if you have heel pain or dropped arches. These insoles can also sometimes help if you have pain in other joints, for example pain in the knees or hips. Podiatrists can look at your feet when you walk and suggest suitable shoes, and some podiatrists are specialised to perform injections into the joints and soft tissues of the feet. Registered dieticians are experts in helping people make choices about their diet and nutrition. They stay up to date by reading recent research and turning this into practical help for people who need advice about any aspect of their diet. Dieticians can be especially helpful if you need to lose body weight, as we know that being overweight is one of the most important risks for developing arthritis, and that losing weight can significantly reduce joint pain and even avoid the need for joint replacement surgery. Dietitians can be very handy if you would like to assess the adequacy of your diet, as people living with arthritis often cut out certain foods, which is completely unnecessary. Orthotists are involved in making and supplying splints and devices especially designed to help you cope with pain and improve your function. They can provide splints for hand pain, insoles for your shoes, and they are often the route to having bespoke footwear especially made for you if you are finding it impossible to find suitable shoes. Orthotists can also supply spinal splints or corsets if you've had a spinal fracture and you are struggling with pain. Clinical psychologists are specialist psychologists who can help people deal with the emotional and mental issues that can affect people living with arthritis. They are experts in treating people with anxiety or depression, and they are often involved in running pain management programs to help people learn how to cope better with their arthritis pain. Clinical psychologists are often recommended to help people with arthritis, but unfortunately psychology availability on the NHS is very limited. The NHS does provide free emotional and talking therapies through a service called Improved Access to Psychological Therapies, IAPT, or through iTalk. It's possible to refer yourself to IAPT or iTalk via a local telephone number for the area in which you live. Lastly, the orthopedic team. You will meet a consultant orthopedic surgeon if you are thinking of having surgery to a joint, for example, a joint replacement. Orthopedic teams also include specialist registrars and therapists to support the team, for example, hand therapists or physiotherapists who can advise on the best things to do both before and after surgery.